Hey, what's up, everybody? How's everybody doing today?
Good.
Waiting for a few more people to go ahead and enter. So what we're gonna do is we just sit around, chill for a second, wait till a little more people enter. Then once more people go in, then we just we hit it up. Let's see, move this over. I'm trying to work with all these screens right now. Thank you for everything, Carbon. Let's see. What up, Angry Sarge? What up now? Thank you for joining us. I know, right? It is our first time, so we see how this goes. Y'all got excuse that noise in the background. I got my little kids trying to put them to sleep, but you already know how that goes. Man, we gotta get out there again, Sarge. We gotta get out there again for real. Dan H, what up, Dan? What up? What up, Carbon? Thank you for everything. Look, if y'all didn't know, and Sarge, you already know, Dan, y'all know, I'm just going our first live. We just trying to battle it out, figure out what's going on. So, got a little bumps here and there, but we're gonna get started. We're gonna have a little bit of fun. So what we're doing is waiting on a few more people to join. Then after that, we're just gonna hit it hard. Hey, Sarge, I do too. I do too. We're slowly picking it up. You see, we branched out into Vegas, so we slowly picked it up out there. Just trying to make sure we don't spread ourselves thin, if that makes sense. Now, Corey, are you able to see the comments at all?
No, I'm not able to see them. Where would I? Is it in the chat?
Yeah, it's in the chat. Yeah.
Okay, I can see the chat. I think. Let me see. Let's see comments. There it is. Yeah. Oh, okay. Now I see it. I see.
Hey, Mom.
Is that Miss Hall?
Yeah.
My mom was just asking about you, Miss Hall.
Yeah.
All right.
Let's see. Waiting on Derric to get back and we get started.
Very nice.
But everybody, thank y'all for joining us. Solution also with Koi for Koi Wellness Solution. Make sure I get it right.
Yes.
Give us a little background about us for Whiteside Type of Solution. We have two locations. We have one in Atlanta, Georgia, or the Metro Atlanta, Georgia area. We also have one in Las Vegas area as well. I run the one in the Georgia area. My brother Derric Whiteside, or Dr. Whiteside, he runs the one in the Las Vegas area. Then every once in a while, we get together and do different types of training. Today, what we have is Koi, Dr. Koi Ibrahim with Koi Wellness Solutions. Koi, tell us about you.
Man, first of all, I just like to thank you guys for offering this platform. I mean, this is a wonderful thing here. These guys, I want to tell everybody here, if it wasn't for these guys, I probably wouldn't have got through high school. I always tell I tell everybody this, even Miss Mary Hall, thank you for being here. But this is kind of like a family reunion. These are my brothers. We've been through a lot together. They were there for me during my track days, to get me through physics in order for me to become a doctor eventually. They were the ones pushing me like, yeah, you need to come and take physics. You need to take physics. I'm like, nah, I don't want to take physics. Yeah, you're going to take physics. But yeah, a little bit about me. I'm Dr. Koi Ibrahim, co-owner of Koi Wellness Solutions, along with my lovely wife, Brittany Ibrahim. And we have a holistic functional medicine and corporate wellness practice. We're based out in Fort Lauderdale, Florida, but we treat patients that deal with type 2 diabetes, hypothyroidism, but also really helping companies and businesses, employers, to help them recover from the pandemic and the sedentary lifestyle. And we supply solutions that give them companies challenges and help them with their health and wellness in order to recover properly, to help lower insurance costs, to help individuals just become healthier and become more vibrant. And so with our practice, of course, we deal with type 2 diabetes, chronic illnesses. We are a functional medicine practice where we get to the root cause of the disease process and not really truly just relying on medications to help individuals, but actually get to the root cause to reverse it holistically. So that's a little bit about us. We've been in practice for quite some time. Between my wife and I, we have over 25 years, combined years in health, wellness, and fitness and corporate wellness. So we love helping individuals and businesses become a better version of themselves.
Cool.
Yeah, man.
Now, Dr. Whiteside, tell us about yourself.
Well, you already know we twins, so I'm Dr. Derric Whiteside. I'm board certified in internal medicine. I'm also an acupuncturist. I'm more of a DO, and I'm not an MD, so I'm a doctor of osteopathic medicine. What that means is that we do more holistic medicine, such as Dr. Ibrahim, and we treat the body. So our mindset is we treat every person as an individual and not just another number. We take our time to get to know the patient. I like to always tell patients, somebody might come in with a headache and I'm looking at their foot and they're saying, well, why are you looking at my foot? My thing is that the body likes to be in balance. So if you have actually your foot, you have something wrong with your foot, which will travel all the way up and eventually cause you a headache. So we like to see the body as a whole. I think of myself as more as old school medicine. So I like to think back in the days when we used to gather our own foods, tend our own gardens, we were healthier then. So we allow the body to heal itself. I can prescribe medication and I will do that if I have to, but I like to try to get to know the patient, get to know their background, get to know what's going on with them, and alter my treatment plan and my treatment regimen to fit them better and to fit into their lifestyle.
All right, so yeah, thank you. And y'all already know me, Derric Whiteside. Like I said before, I'm not a doctor. I'm a school teacher. So basically, you got to start with me to get to their level. So we teach you all how to get to that level. So that's what we do. One thing we said at Whiteside Tax Solution, we like to present all the medical information to you all, even though we have the word tactical in our name. Is not for us. It's not solely focusing on firearms. It's actually more of the medical, tactical medicine is what we actually love to do. In addition to that, advanced cardiac life support, pediatric advanced life support, things of that nature, emergency pre-hospital medicine. In addition to that, like just breaking news for you all, we're actually building our school. So when it comes to that, we're offering EKG technician, phlebotomy, as well as DNA testing and some more things. So you can hear more about that later on. But we're trying to do big things, bring it all to you all, not just the training portion, but also to educate. We want to train the world. We want to train the local society as well. So that's what we're doing. We're trying to bring all this training to you all. There's some that we have to, do a little bit of charging for, but we want to keep it as economically feasible as possible. So if you're interested in anything that we're doing, just drop us an email. We'll work with you all on all of that. Now, with that said, we're talking about type 2 diabetes. What actually got you all interested in focusing on type 2 diabetes? And what is the difference between type 1 and type 2?
Yes, I'll go ahead and go. Type 2 diabetes is as I say, it's more than a blood sugar problem. Type 2 diabetes is an issue where an individual is not able to function where, we eat food, we digest our food to be able to create energy for each cell of the body to have its normal body function. When that does not occur, it's a big problem for the body. The energy does not go from the energy sources did not go where they need to go from the circulatory system to each and every cell that the body needs to be used for its function. When it parks in the bloodstream, it's very toxic to the system. It's a degenerative process. And unfortunately, when we look at the leading causes of death, the 10 leading causes of death, 6 of them are either related directly to diabetes or have impact as a complication or a symptom of diabetes. We're talking about heart disease. We're talking about stroke. We're talking about Alzheimer's, which is coined type 3 diabetes. We're talking about liver dysfunction. We're talking about kidney issues. These main issues are the leading causes of death when a person is not able to normalize their blood sugar without the use of medication. And so when we see this, and you look at this as a factor that basically leads people to have premature death, it is a major issue, especially amongst men. And so this is a major concern, and this is one of the reasons why our practice exists, because most often individuals with type 2 diabetes are not being told why they have diabetes or how to address the diabetes, not only holistically, but to get to the root cause and to reverse it. And so this is how I got into it, being in health and wellness. I have a bachelor's and master's in exercise sports science, along with a doctorate in chiropractic. You know, seeing these issues along my career, it's something that is a big problem in the United States. And 1 out of 10 individuals are being diagnosed with type 2 diabetes. So if you can just go out to the local mall and pick out 10 people, one of them are going to be a diabetic. And 1 out of 5 individuals have pre-diabetes. And so these are the factors that we see along the way. And so our main mission is to help individuals get to their root cause and to reverse it.
Yeah, you got it. You got it. Now, from my standpoint, I definitely agree with Dr. Coy. He right on the head. That's spot on. And I like to tell people, kind of break it down a little simpler, is that your pancreas, which is the main source, is not pushing out enough of the insulin to bring your sugar level down. That's what's really going on. So we know that something is going on inside the body. The catch is, why is it taking place? Some physicians will just say, well, it just happens. Well, nothing just happens. There's a root cause behind it. And me, from my background, I like to figure out what is the root cause? What is the driving force? Is it that your diet? If it's your diet, let's fix your diet. Is it lack of exercise? Well, let's do that. Is it because you're actually overweight that's causing your body to work harder? Like Dr. Coy said, well, we need to get you to lose the weight. As a provider, I can push medicine all day. But the point of it is that I actually want to see what's the issue and try to reverse it without putting you on medication. Because any medication I put you on, there's always a side effect. And of course, I got medicine to fix that side effect that will cause another side effect. So it's always a spiraling effect. So let's find out the root cause. Like you said, there is type 1 and type 2 diabetes. The type 1 is something you can't really do much about. It's an autoimmune disease. The body is attacking itself. It's what we really don't see that other than when you're first born, or usually single digit, almost beginning of double digit. It's the type 2 that we key on because we're concerned more about what we call metabolic syndrome. And that's just, you are not taking care of your body the way you should. And it's just educating the average person on what needs to be done to really keep them healthy.
All right. So, I mean, like, honestly, y'all almost above me on some of that stuff, but no, it makes sense. It does make sense. So when it comes to that, how can people actually avoid type 2 diabetes, or what? How does that work? Because I know you're talking about diet and exercise. Can people actually avoid that?
Well, I'll let you go, Doc.
Well, you know, it is something that you can avoid. And one of the things that in my practice, unfortunately, sometimes people have gone through this whole diabetes continuum and being in being a diabetic for 5, 10, 15, 20 plus years and being through the spin cycle, so to speak, with treatment, failed treatments, and are experiencing the diabetic complications. We're talking about heart attack, stroke, chronic kidney disease that leads towards dialysis. We're talking about poor wound healing, poor circulation that can potentially lead to amputations, blindness, with retinopathy. So a lot of these things, unfortunately, as human nature, folks will wait until it gets so bad before they look to do something about it. And, obviously we want to be able to prevent those things from happening to where a person doesn't have to go through a rigorous treatment like dialysis or, have a heart attack or stroke that could potentially lead to death. And so, yes, it can be reversed. And if you're proactive with a healthy lifestyle, is understanding that, yes, we need to have an active lifestyle. Yes, we need to be able to eat good foods and drink clean water and have good practice good mindfulness exercises for our mental health and those things, but also minding our environment as well that we live in, taking care of that environment. And so again, with type 2 diabetes, if you're really looking at the components of how and why a person is a diabetic, you always want to find out what are those missing pieces, what are those areas of a person's lifestyle that is missing, and then you make those connections. And that's how you go about really trying to prevent that from occurring.
Yeah, now for me, I like to always tell my patients, because they say, oh, the doctor says I'm a diabetic. Well, to be honest, you didn't just become a diabetic. Your body was actually going through it. And I talked to Dr. Corey about this earlier, is that I like to ask my patients, when did you start having the symptoms of frequent urination, frequent thirst, just fatigue for no reason, feeling run down, always getting sick? And most of my patients will think back and say, well, that happened a few months ago. I said, that's when your body was transitioning over to becoming a diabetic. The key is to now prevent it. So diabetes, like Dr. Corey said, comes with a lot of complications and implications. You want to prevent any further damage to the rest of your body. The longer you let the sugar level remains high, then that means there's damages to the vessels in the body. People think, oh, it's just going to be about heart. No, you have vessels going all over the body. It's going to your brain. So hence you're worrying about a stroke. It's going to your eyes. You can actually lose your vision. It's going to your heart. You can actually end up having a heart attack. For my guys, I always tell them, if you don't get it under control, you're going to result in erectile dysfunction. The little blue pill and Viagra and Cialis and all these other medicines, they're not going to do anything for you because you have lack of blood flow to that area. So we want to get the sugars under control. I like to tell my patients, let's work on weight loss. People think, oh, I just got to now be a rabbit and eat rabbit food. Nope, that is not the case. You just watch your carb intake. That's what I like to tell a lot of people. Just kind of watch your carb intake. It's a complete lifestyle change. I don't expect any of my newly diagnosed diabetics to be perfect at it at the beginning. If I was a diabetic, I would be a horrible diabetic. My mom know that. Eric know that. I would eat my junk food. But my thing is, well, what can I do to work with my patients? All right, if this is what you want to eat, you want to eat your junk? Okay, let's limit how much junk you're eating. But let's also offset it with, let's increase your exercise. Let's increase more of your fruits and vegetables into your diet. Let's get your energy level up. We can then work on getting the weight down and getting your sugars under control.
All right. What else, y'all? Yeah, you talking about erectile dysfunction or eating, basically with eating. Y'all got excuse my kids, like say they popped in the green screen like Dan was talking about earlier. They running up and down. They like, oh, we got free reign right now. Like, Daddy busy. We're gonna do everything, which pretty much they are doing right now. Trying to keep this poker face, but it is not working. But yeah, Urban was talking about people losing limbs. Now, when it comes, how does that come about when people are losing limbs? Is there a way to actually, well, I know there's ways to prevent that, but what's the cause of that?
Usually the cause of it is lack of blood flow to the area. And the concern is that, like I was saying earlier, your sugar levels get so high and your so much sugar is in your blood that it starts blocking flow to the rest of the body. And then if they're not trying to maintain the blood flow to that area, lack of blood flow means that limb will no longer work, which means it will soon eventually die off. We have blood vessels that go to all our body. The blood vessels help give blood, oxygen, nutrition to the body. When you cannot get nutrition to that part of the body, that part starts to slowly die off.
That's right.
And if it gets bad enough, you will actually lose that limb.
Yeah, I always say that if you are not able to adapt, you die. And when that occurs, where again, when you're not able to deliver that glucose, that the food that you've eaten, digested, and it breaks down to these glucose molecules to supply energy to every cell of the body. When that process is stopped and all that glucose is parking in your bloodstream, it's a very toxic situation. It's like saying, let me pull up to the gas station and try to get gas in my car, but instead of putting it into the car, I just pump the gas and just spray it all over the place, right in front of my car, around my car. It's not getting into the right place. So there's going to be a toxic situation. And just if you repeat that over and over and over again, there's going to be some consequences to that. Of course, we're not cars, and we're not, doing that crazy analogy exercise there. We have a circulatory system that, just like Dr. Whiteside said, is that we're trying to supply all those nutrients to the body. And unfortunately, the body would tend to not make a mistake. It would rather cut off something than to add on more fuel to a disease process. And in my view, what I've seen diabetes is almost like a protective mechanism. It's trying to stop you from adding more fuel to dysfunction. And unfortunately, when we have our limbs, they're going to get the last dibs on energy or function. And so when those things are not getting this proper nutrients, that's when we see the wound healing, the poor wound healing. That's when we hear and feel the neuropathy. That's when we see the discoloration in limbs and these factors where we see, poor nail growth and all these things that happen where we have the numbness and tingling. And those are just signs that are leading toward amputation. And so this is what, again, we need to really shed some light on these situations, because I've never met a person that hasn't had an amputation that didn't start out with neuropathy or some swelling or some discoloration. Those are the first signs that you get to see. But if you're not proactive to do something about it, that's where we see, unfortunately, those amputations, those complications to occur.
Yeah, and I like to tell people the body likes to stay in homeostasis. And when I say that, the body likes to be at balance. The body never likes to be too high, too low, too left, too right. It wants to stay right in the middle. So the body will find a way to get right back into the middle. So when your sugar levels are too high, which is a sign of diabetes, what it is that the body starts telling the brain, and you don't even think about it, drink more water, because you're trying to actually get your sugar level down. When you drink so much water, you're peeing it out. Another way the body says is that my sugar level is too high. All right, body, how do I get rid of the sugar? Go and pee. I need you to pee nonstop to get all the sugar out of your body. Back in the days, we didn't know about diabetes, and then the way we found out is that this person actually, I had to say it, they used their urine and they put the urine out, and they saw all the bees and flies coming over to it. Well, bees and flies tend to go to somewhere sweet, and that's when they check the urine and realize about the glucose. That's how we started learning about diabetes. So the body is saying, my sugar level's too high. Let me get in balance. Let me pee it out. Let me drink more water. But it will get to a point where your body says, all right, you're not doing what I need you to do. Then you'll start being sluggish. You're like, I can't think as well. I'm groggy. What the heck is going on? And we tend to just run the blood work and be like, hey, yeah, your sugar levels are too high. Let's get this under control before it's too late.
Quick question, because I know Dan H brought it up when
Yep.
he talked about why is it that it's always occurring in the feet or the periphery areas. For example, for us, I'm always seeing amputations, DKA or something of that nature. Why is it always occurring in the feet instead of like the arm or the leg?
Well, you're looking at your larger vessels. So you have larger vessels in your arms, in your legs. When you go further away from the heart, the vessels get smaller and smaller. The smaller the vessels get, the more plaque develops in those vessels, the less blood flow is going to those areas. That's when you start having the we call it neuropathy. That's when you start having a tingling sensation. That's when you start having the swelling. That's when you start having the pain, because there's actually lack of blood flow, lack of oxygen that's going to that area because the vessels are so small.
But it's also distance too, or away from the heart, right? So when those when you're not able to get the nutrients, get that circulation all the way to the distal ends of the body, again, those are the areas that get hit the hardest oftentimes. But often when we're talking about the circulatory system, you know, this disease is a macrovascular, but also a microvascular degenerative disease. And so by the time it's affecting those distal ends, it's pretty bad at that particular time. And most often, again, with human nature, you know, if you're not feeling it or you're not seeing it, it's not stopping you, it's not knocking you down.
Mm-hmm.
You know, you'll tend to keep going, and it's a little numbness. Let me just shake it off. Let me just exercise it off. Let me just, you know, rub a cream on it. Let me just, you know, put some snake oil on it and keep it going. You know, and that's how this goes over time. Where it's been a diagnosis, like Dr. Whiteside said, you know, this is something that's been happening. So this doesn't pop up at the time of your diagnosis at that doctor's visit that you happen to be in. So,
and Spivey brought up a good question. What up, Spivey? So I just realized it was her. She's talking about hypothyroidism, diabetes. Are they related? Because again, they're both dealing with glands. So can you explain how those two are actually related?
You want it, Dr. Corey?
Yeah. And this is, you know, up my wheelhouse, because in my practice, we deal with hypothyroid patients. Obviously, the thyroid is a gland right there in the front of your neck. I kind of call it the gas pedal to your metabolism. It delivers hormones to allow the cells to be able to function. Every cell of the body has thyroid reception, and when it's affecting your metabolism, it affects other hormones to allow you to have the normal body function that you need. The key with hypothyroidism, though, is that hypothyroidism is a very prevalent issue where the hormones are not being delivered properly. There could be a conversion issue of how some of the hormones convert from active from an inactive form to an active form. And unfortunately, 80 to 90% of hypothyroid patients have an autoimmune condition of the thyroid, and it's called Hashimoto's thyroiditis.
Mm-hmm.
But unfortunately, when we see that it's an autoimmune condition, that means that the body is actually attacking that thyroid and destroying that thyroid. And so when we see this occurring, this in itself is going to throw off your blood sugar, because there's going to be, you know, hormones that are not being used properly, and the body is going to see that imbalance. And this is where this occurs, where, you know, either, you know, a person that has developed hypothyroidism throughout their life, you know, it could have been around puberty, it could have been around the birth of their first child, it could have been after a severe accident, like a car accident, and it could be around perimenopause. And so any of these milestones, majority of these things happen with a female, you know, this was when the glucose starts to act up. That's when you start hearing, well, now you have pre-diabetes, because the body is not able to balance itself because of immune system dysfunction. And so when you look at diabetes, whether diabetes started first or you develop into hypothyroidism or reversed, you know, you have to play these two parts. It's almost like they're Bonnie and Clyde moving together. You have to really understand the mechanisms that causes these issues and address them individually.
Then I like to tell my patients, when I have a diabetic patient, then I actually check for thyroid disease. They tend to go hand in hand, like Dr. Coy said. And the reason is pretty much a genetic issue. You're thinking of diabetes is actually trying to destroy itself. And then, well, sorry, you're thinking of genetics and the attack on its body. Well, then you're also thinking, well, the thyroid is attacking itself and the body's attacking everything else in itself. So you're saying, all right, if I have one issue, then I'm looking for a background from me internal medicine. I'm more investigative. I look for other issues. My job, I consider myself the mechanic of the body, and I say that from the standpoint I'm looking for things. I draw labs. I look at lab works. I listen to the patient, but actually listen to the labs. I look for trends because the labs tell me what's been going on in the body. The patient can tell me one thing, but the labs never lie. So that tells me, all right, well, this level's high. Well, if this level's high, let me look over on this part of the body. All right, well, this issue is high too. Now we see that the body's attacking itself. How can we stop it? How can we prevent it? How can we get the body back under control?
Okay, yo, I'm sorry. If y'all can see here, these kids killing me right now. It is crazy. I'm so sorry. Every time I'm turning around, one eating cheese, one got some apple juice, one blowing a balloon up. I'm like, yo, why do y'all wait till right now to do all of this? So I do apologize, but man, if I take this green screen off, y'all gonna be like, what in the world is going on? They should be hanging from the rafters the way they're acting right now because they know it's time to go to bed. Sorry. Anyway, so get back on that. So when it comes, because you said, was that a Japanese term that you use?
Hashimoto.
Hashimoto.
Mm-hmm.
Okay, I was wondering about that. Okay, so one of the questions is, what did G23? What's up, G23? They say, do you believe that this can be reversed when it comes to diabetes? We know when it comes to type 1 diabetes is one thing, but when it comes to type 2 diabetes, yeah, y'all can hear me in the background. So when it comes to type 2 diabetes, can this be reversed?
Yes, it definitely can. And it comes down to really the provider sitting down with the patient and get an understanding of the lifestyle and getting the patient to alter their lifestyle to their benefit of reversing what initially caused it in the first place. If it is obesity, then let's reverse the issue of obesity because a lot of times when you'll see people that have the beer guts or the muffin tops, people like to say it. Well, you're thinking that it's only fat on the outside, but it's actually you have this fat layer that's covering over the organs. The body is not designed to have the fat layers over the organs. So we need to decrease that fat layer over the organ, especially specifically the pancreas. And once we get the fat layer to decrease on the pancreas itself can start doing its job or be function much better, which then you'll start seeing the levels of diabetes or their sugar levels decreasing back to a normal range. So yeah, it can be reversed. The catch is that when you reverse it, we have to maintain it in the reverse state, or you can go back right to where you were.
Yeah, I mean, I would. One of the things that I see in my practice is that most oftentimes patients are being told the reason why they're a diabetic is because their pancreas is not working. And oftentimes, like you said, Doc, is looking at your lab work and calling for the right labs and really doing a thorough interpretation of those labs. For instance, most doctors would tell a patient that they're diabetic because they're not producing enough insulin without even running the labs on insulin. And often when I do labs with my patients, I see the opposite, is that the pancreas is actually working overdrive.
Correct.
And when that occurs, it lets you know that there is severe dysfunction. And especially when a person is not able to able to normalize your blood sugar, but yet your pancreas is actually pushing out 2, 3, 4. I've seen up to 5, 6 times the amount of insulin.
Yep.
And so that lets us know that the body is resistant to that insulin. That's a term that we hear or you see, insulin resistance. Insulin resistance. And insulin is a very powerful hormone that allows you to bring that glucose from the bloodstream into the cell to be able to use it for energy. It's like a lock and key. So you got to have the right key to unlock that door to get in and to allow access. And so when we see that process going on, you have to understand that when a person is insulin resistant, there's something blocking that occurrence. And a lot of times, again, this is a protective mechanism. Insulin is a fat storing hormone. It is a highly inflammatory hormone.
Mm-hmm.
And so as the key is figuring out why. Why are you producing so much insulin that's not being used? Why are you storing all this fat around the body? And that's just for certain cases. I've seen the skinny diabetic that does not have a weight issue, that is still given the same medications. And we've all seen a person that is, morbidly obese, but has no diabetes. But we can assume they have diabetes, but they don't have it. Versus a person that's 5'1", 120 pounds, has an A1C or has been a diabetic for a long time, but has an A1C of a 10, 12, 15. That's not a weight issue for that person. But a person that is been suffering from diabetes, you have to understand that, okay, what's going on with these mechanisms that are not, creating that homeostasis, that are not allowing a person to be able to normalize their blood sugar without the use of medication.
All right, so here it says day and age, because for me, working on the streets as a medic, not as a stripper, but as a medic, so working on the streets when it comes to that. So we face this a lot when the females do not get their prenatal care like they're supposed to. And here, day and age said, then doesn't pregnancy also contribute as a factor for starting this? So when you think about pregnancy, gestational diabetes, how does that have a role in it?
Well, you're looking at kind of two different things: gestational diabetes and just a patient being pregnant. So when a patient is pregnant, when a female is pregnant, they have increased fluid production, they have increased hormone levels, but it's not necessarily making them a diabetic. They don't have, somebody made in the comment, the visceral fat. They don't really have that. That's not the issue. What we do as providers is we're actually checking the sugar level while they are pregnant. We check it at certain intervals to make sure that now the pancreas is not working too hard, pushing out too much insulin because the sugar levels are elevated. If they are elevated, then we're concerned because then they have gestational diabetes, which means they have diabetes during their pregnancy. A lot of times is that the patient will, or the female will then deliver the baby, and the diabetes levels or the glucose levels will go back to normal. We have seen studies have proven now that if once you have gestational diabetes, you are now at increased chance of becoming a diabetic later on in life, typically in your 50s. And that's just because the pancreas has been working so hard. Like I said, the body wants to stay in homeostasis. It wants to be in balance. And so during the pregnancy, if the sugar levels are so high, the pancreas has worked so hard that it says, thank you, you're delivered, I'm having a break. Oh, later on in life, now I'm starting to struggle of pushing out the insulin I need to get your glucose levels back down.
All right, so here, vision. Oh, going back, G23. That's a good thing. Let me put this back up real quick for G23. So at the end of January will be 2 years since I was hospitalized with flesh-eating bacteria in the groin, and found out I was diabetic. My A1C was 10.7. Now I have it at 5.9. Now, can you explain a little bit? Vision, I got you. I'm gonna get to you in a sec. So, can y'all explain to me when it's talk about A1C being 10.7 or 5.9? Could you stop? Could you see? Oh my goodness! So, because you see it all the time, I know, right? Because you see it all the time on the commercials, the diabetic commercials.
Yeah.
So, explain A1C and what's a good range for A1C.
Yeah. So, really, the full name is hemoglobin A1C, and that is the definitive marker for blood work that a doctor or a medical professional will look at you and tell you whether or not you're a non-diabetic, a pre-diabetic, or a diabetic. And it's basically it's a scale, it's a number scale, right? And so when we look at non-diabetes, A1C, which is the marker, it should be less than 5.6 or below, right? So that's the number. And that basically is a number that shows that balance of how you're able to have your proper metabolism and how much glucose is residing in the bloodstream. Now, when you go beyond that 5.7 to a 6.4, that is termed pre-diabetes. And then when you go to 6.5 and above, that is definitively the diagnosis for type 2 diabetes, right? And so some folks will say, well, I'm pre-diabetic. Well, that's where you have to look at the A1C to determine where you sit. Same thing with diabetes. The key to it is that the higher the number, the worse that it gets, or your likelihood of developing complications to diabetes jumps up exponentially, especially after 7, right? And so the higher that it goes, the more complications can result from that. Now, for instance, like when you pull up lab work, unfortunately, some labs will only go up to 14. And it doesn't even go beyond that. I've had patients that I've helped reverse their type 2 diabetes, and on their initial lab work, it just said 14 plus or greater than 14. Yeah. We don't even know how high or how bad it is. And been able to reverse their diabetes and finally get a registered number that we can actually work from. And so that is where we look at A1C, and then also you'll also look at your glucose levels. So when you look at your lab work, you'll see glucose, and really that's why they tell you don't eat anything, don't drink anything that is outside of water, or eat anything past an 8-hour time frame, because they don't want to see your glucose levels to jump up. They want to see your fasting glucose. But then you can even go a little bit deeper, and actually it shows the average glucose level for up to 3 months prior to that test. So that, just like Doc said, the labs don't lie. You can tell a person, you can say, yeah, I eat well, I eat like perfect. I don't even have an analogy to talk about that, but I'm just saying the labs won't lie, because you can see that's your report card. It's going to show up to 3 months prior to that test, and they say, well, I'm not a diabetic. Yes, you are. And you've been a diabetic for at least 6 weeks, at least 8 weeks, at least 3 months. So it shows a track record.
And then I'll let people know when you're looking at, it's the A1C. So the A1C is a small molecule that sits on the red blood cell in the body. The catch is that the red blood cell stays in the body for 120 days, pretty much 3 months. Mm-hmm. So when I draw lab work, or even Dr. Coy, when we draw lab work, it tells us how your blood sugars have been running the prior 3 months. I personally do not check people's blood sugar during the holidays. So October, November, December, January, I don't check blood sugars, because to me, I'm thinking if I was a diabetic, I expect my diabetics to actually eat what they want or indulge in the stuff they usually can't because of the holidays. But I tell them, I'm going to check it before October and I'm going to check it around March. I'm going to know. Now, if you keep eating junk past March or past January, then I already know you haven't been doing what you're supposed to. But I let the patients know it stays in your blood. I know for 120 days how you've been doing. And like Dr. Coy said, I've seen blood sugars when it says, well, not blood sugar, the A1C says 17 or greater than. Usually those are my patients that's in the ICU because they're legit in a diabetic coma. Oh, and typically those patients that are that high, those are your newly diagnosed diabetics that did not know they were diabetic, and that they had all the warning signs and symptoms for several months but continue to ignore it.
All right, so here Vision talking about type 3 diabetes. I'm not familiar with that. What's the type 3 diabetes? Because that's new to me.
Yeah, type 3 diabetes is basically diabetes of the brain. And we all know and seen or heard about Alzheimer's disease, right? And it's basically the brain obviously is the control center for the body, and it gets first dibs on energy. And when the body is not able to give that proper energy or to resource the brain with its proper function, we see these development of plaque. We just see the development of a downgrading or a degeneration of these brain cells. And so we see that occurring, but this also speaks to insulin resistance and risk of stroke, because of the vascular issues. Again, we go back to how does the energy get from point A to point B? It's the information highway. That's the circulatory system. And so when when that is not occurring, or that continues to degenerate, that's when we see the first signs of type 3 diabetes. It could be brain fog. It could be, poor memory, just things just slipping out of your head. Poor stress management. When we see that you're just not as sharp as you used to be, when we see signs of your mental acuity starts to diminish, these are the factors that lead up to the Alzheimer's. And unfortunately, we just think it is an old person's disease. But just think, the longer you live, the more time that you have with this degenerative disease, the worse it gets. And so this is what we're seeing and hearing about now, is type 3 diabetes. That's just diabetes of the brain. The brain isn't being able to function properly.
So here, Urban Chronicle, she was talking about, are you saying intermittent fasting, will that help? So like carb cycling, will this type of stuff actually help with the diabetes?
It depends. That's a popular thing that people like to do. They would talk about fasting, and oftentimes with fasting, you have to be careful with fasting. It's not for everyone. It's not for every patient. I would really consider speaking to a professional about that and the purpose of the fasting. Oftentimes people think that type 2 diabetes is just simply a blood sugar problem. Well, if I don't eat, then I'll bring my blood sugar down. And that's not the case in all people. When we were just talking about that gentleman that had a flesh-eating bacteria, for that individual, that bacterial infection was a root issue for him. So telling him to stop eating or to fast may be a big problem for that individual. Just making that analogy or making that example. But again, with fasting, is something that you have to really understand, and really understand the consequences of it, the pros and the cons of it, in order to make a healthy decision.
So here again, you guys excuse my background. The kid's killing me right now. So Vision talking about type 3 diabetes. How do we, I guess, prevent this or correct this or reverse this? Because again, like I was telling him, this is totally new to me when it comes to type 3. I know you got type 1, type 2. Type 3 is new to me. So if somebody has type 3, how can you prevent, or is it possible to even reverse? Because you were talking about reversing earlier. Is it possible to reverse type 3?
Yeah, it's possible to reverse it. And I say that because it comes down to controlling your risk factors, controlling what is going on. So, like I said, the diabetes is producing plaque, or you have plaque development in the vessels throughout the body, which includes the brain. You will work on getting your sugar levels down. That will help prevent and reverse what is going on. Or I would say it helps prevent further damage to what is taking place. Now, once damage is done, There's no reversing damage. The goal is to prevent any progression of further damage. So we want to keep your sugars levels down, as I won't say as low as possible, but in a normal range. And that will prevent further plaque development. But we also have to keep in mind, it comes down to proper nutrition. Our body needs the proper nutritional source to maintain balance. And I keep saying balance because it's always balance. The body needs to stay at balance. So yes, type 3 can be reversed. It's just that the provider, whoever it is, has to sit down with the patient. And I tell my patients, listen, doctors are not gods. A lot of people think, they try to put docs on pedestals. That is not the case. I like to sit down with my patients. I like to get to know my patients. I like to get to understand what is going on in a patient's lifestyle and what's going on with their home, because whatever's happening at their home if I give them medicine, but their lifestyle doesn't allow them to take the medicine on time or do what they need to, then I'm actually wasting my time and theirs. So I need to get to know them and figure out how I can adjust whatever regimen I think would be best for the patient to get them to be compliant. But it's not just me. I can have the patient say, I need you to do this. No, I like to sit down and say, what is it that you would like to do? What can I sit down and get you to do? How can we get to where we need to be together? I don't want to make the decision for the patient. I need the patient to be informed and make that decision on them, because when the patient takes the onus on themselves, they will do everything they can to reverse the effects. They will start learning, oh, I'm getting better. I'm doing this on my own. That's what I want the patient to do. I'm only here really as a guide and to be a cheerleader for my patients. That's what I'm here for. Yes, I went to school to do all this, but I'm their cheerleader. I want them to be able to get better. So my thing is, the more I cheer them on, the more I'm their support system, the better the patient becomes, the better the patient lifestyle is, the more longevity they will get to actually achieve.
Okay. Going to hit G23 question. What type of doctors are y'all? I know we hit this earlier. Can y'all explain again what type of doctors you all are?
Yeah,
I'm not a doctor. I pretend to be one because I watch a lot of TV. So I think I am, but I'm not.
Well, when you say doctor, the meaning of doctor is teacher, by the way.
Right.
So you can lump you into that. You're a teacher. We're teachers here, but yes, I'm a doctor of chiropractic, and of course with chiropractic, it's one of the, I guess, first cousin of chiropractic is doctor of osteopathic medicine as well.
Yes.
And we're in that same family because we always know that the body has a unique ability to heal itself. And so if we know that, we know that the body, when it's been put in the right position to heal, it's going to perform miraculous things. With the limitations of matter, of course. So we just got to make sure that we put the body in the best position to heal, to provide that balance, to make sure that you're addressing the root issues. And so that's what we're doing now.
Yeah, my background is internal medicine, so really it's primary care, but we do from age 18 all the way up to death. And we take care of people with multiple complicated medical issues. So the more issues you have, the more I drew, the more excited I get. So if you have diabetes, you have heart attack, you had stroke, now you have cancer, you have lung disease, all that kind of stuff. You have thyroid disease. That's the stuff I love, because I like to figure out how all this is intertwined and how we can try to get you to be the best form of yourself.
Mm-hmm.
Great. So my question is, I know y'all like, boy, this boy keep asking me questions. Anyway, y'all can get over it. So my question is, what are some things, because let's be honest, when you go in and see a doctor, a lot of people are intimidated to even ask questions.
Yeah.
So what are your suggestions for, I know Dr. Whiteside, you were talking about, or Derric, or Dr. Whiteside, that's the first time I said that.
Oh, boy.
I know. That's a slip right there. Well, yeah, Derric. No, but Dr. Whiteside and Dr. Corey, when it comes to that, what are some questions you wish that your clients or that your patients would actually ask? Or what are some things we should even ask, like G23 is talking about? What are some questions we should ask our PCP? Things that we may not think of, like 4 or 5 questions, hey, you should be asking this. For, let's be honest, not everybody get a routine physical. So what are some questions we should ask just in case we think we may be diabetic, we have a family history of it?
Go ahead.
Yeah. Okay, so for me, I tell people, write all the questions down at home and bring it in. I literally get ticked off when I have patients come in and they try to go off of memory. Don't go off the dome. I get excited when they bring in a whole scroll, because that means they're taking the time out to get to know themselves. If you come out with 5 or 6 questions, that's great, because most of the questions are related. I want the patients to find out, just simply say, what's going on. If something in particular is hurting you, I need to know where it is hurting you, how long that's been going on. What have you been doing about it? If you're not feeling well, when did this start? How long has this been going on? Have you sought medical care somewhere else? Are you coming to me for the first time about this issue? Okay, let's sit down and get to know what's really taking place. I work in the military, so I have more time than the doctors in the civilian care. In the civilian world, honestly, it's all about numbers. It's all about time. You have about 15, 20 minutes with your doctor, in there, out the door. You don't have time to talk to them. No, I tell patients, question your doctor, question your provider, question anybody that's giving you medical treatment. The reason why you're questioning them is not to question their authority. You're questioning because you want to become informed. I tell my patients, I need you to become informed. I need you to understand what's really going on. I'm giving you this pill, but I'm telling you and I'm informing you why you're taking this. If you don't want to take it, that's fine with me. We can discuss back and forth. It's not an argument, it's not a debate, it's actually a discussion. Because, like I said earlier, every pill comes with a side effect. So let's have a discussion about your health care. I need you to see me on a routine basis. People think, well, every 3 months. No, at least twice a year, unless you have ongoing issues. The more issues you have, the more often I want to see you, because we want to try to take care of those issues ahead of time instead of letting them fester and you say, oh, well, I had this foot pain. I'll see my doctor in about 6 months, so I'll just wait then. Nah, heck no. Let's go ahead and get you seen sooner so we can make sure we take care of that foot issue. Because if you have that foot pain, now you can't do your normal routine. Your body starts breaking down. You start sitting around. You start eating junk. Your health starts fading. So let's take care of your issue ahead of time. There are so many questions that I can tell a patient I want you to ask, but I need them to actually come out and ask me, and then we sit down and have that discussion.
Yeah, in regard to diabetes, I think, there's so many questions to ask about it, but I think if you can kind of, like Doc said, is come in with a plan and have a game plan of questions to really talk about. I mean, you can start off with understanding what the diabetes is, asking questions about the diagnosis itself. What is it? And how does this impact my life? How do you manage it? Is this something that is going to be managed with lifestyle changes? Is it going to be managed with medications? And understanding the pros and the cons of that. Obviously, the treatment. What type of treatment plan does that doctor have? Understanding what those things are makes a big difference. And you have numerous questions that a person can ask about diet and nutrition. What is their approach to addressing the diabetes? But again, I think main thing is how does this impact your lifestyle? What are the things that you can do to empower yourself? Within my practice, of course, I'm looking to help individuals to get to their root cause and find out how do you do this in a holistic manner to help you reverse it, addressing why you have the diabetes. That is a big question there. Is, Doc, why do I have diabetes? And if you know the why, then you can be able to address the real issues front and center. And I find that patients, by the time they come see me or they find me and I go through this process, I always ask them, well, what did your doctor tell you why you have diabetes? They're stumped by that question because they're never told the why. They're told what they had, but they're never told the why. And that is the real, that's the one big question that needs to be answered. And if you can be able to get to that, that helps you to open up the gateway to a resolution.
Cool. That's the biggest thing. Like you say, when you're a doctor, and somebody else said in the chat, is about getting them in, getting them out, pushing the meds. And as educators, I'm an educator, you all are educators. It's important that if you have a PCP, challenge them, question them, why is this? Because if they can't answer that, get rid of that doctor, find another. Because again, this is your life. And if they can't do that, move on to another one that can actually answer your questions. You're paying for their time. Since you're paying for their time, they better answer those questions. So, honestly, that's how I feel about it. I'm a little more aggressive than others when talking to doctors, but that's because I hang around y'all all the time. Now, question, G23, he said, have y'all watched What the Fork and Fork Over Knives? Look, to be honest with me, if it ain't one of these kiddie shows or YouTube, I ain't watching. I ain't gonna lie. Either that or back of my eyelids, and I get very little sleep when it comes to that too.
Yeah, I've never heard of the show or the movie, so I'm not sure about that one.
Yeah, I haven't seen it.
See,
Sorry,
that'd be something I'm trying to watch
I
this
feel like
weekend.
I'm not in. I feel like I'm not a part of society right now.
Yeah. Now there was somebody that made the comment. I'm gonna mess it up. It was Ghost something. So Ghost, for you and a lot of other people, what I tell them to do is that you're given a primary care provider, but you're not obligated to have to see that particular person. You want to find somebody that meshes well with your personality. That's what you want to look for. Because as a provider, if I'm working with somebody, I need us to mesh well so you can understand my thought process, so I can understand yours, and then we can work together. If you have a doctor that says just do this, and then you don't understand why, and they don't want to explain it, you, like Eric said, you need to go somewhere else, because you need somebody to actually educate you and sit down and take the time to explain things to you. That's what is lacking in the medical community now. We don't take the time to sit down and teach, and that's what we should do as providers. One, we don't have the time. Two, it's insurance regulations forcing us to hurry up and push through. But we can, as providers, get this done in an efficient manner to answer as many questions as we can and keep seeing the number of patients we have to.
Okay, cool. Answer that one. G23, he said there are diabetic documentaries about diabetes. So I'm gonna actually pull that up. Like say, Vision said type 3. I've never heard of type 3, so I'm actually looking at that as well. Because these look, y'all very informative. I thank you because I talk to y'all all the time, but they hitting us up with questions. I'm like, yo, I never thought about that before. That's a good question. So, and for you all to be honest, which is what I love, and I tell people all the time, if you have a doctor, ask the doctor questions. We're always available. Well, they're available. I pretend I'll Google something in a heartbeat, to be honest with you. So, but available. So if you have questions, just ask away. We're not here. We're not going to hide away from or shy away from an answer. If you have a question, ask it. If I can't answer it myself, I'm going to the doctors, going to the experts. I have no problem. So, and if you have questions, ask away because it's very important. We're wrapping up on about an hour and about a little over an hour, about a minute over an hour. Mm-hmm. Carbon, can you drop all their contact information? Dr. Coy, sorry. Yes. How can they get in contact with you? Because, like, say you're in Florida, but you see people in other states as well. So when it comes to diabetes, how can they get in contact with you? I'm biased, so you're one of the best out there. Yeah, you're my brother, so you don't count. So Corey, you're one of the best out there. So how can they get in contact with you? So if or how can I refer somebody to you?
Yeah, so Koi Wellness Solutions. So Koi, like the fish, KOI, Wellness Solutions. That's on Facebook. That's on Instagram. I'm actually hosting a live webinar tomorrow at 6 p.m. Eastern Standard Time. So if you find our Instagram page, you can send us a DM. We can send you a link directly, or even on Facebook, we can send you a direct link to that webinar that I will be talking specifically about how we're able to reverse type 2 diabetes. And so I welcome each and everybody here that's on this platform. Again, thank you so much for offering this opportunity, because again, type 2 diabetes is something that is very close and dear to my heart. I've seen it in my own family, and I want to be able to supply the truth about type 2 diabetes. So again, Koi Wellness Solutions, and that's on Instagram and Facebook. We have a webinar tomorrow at 6 p.m. Eastern Standard Time. I hope you guys can make it. And if you can't make it, please let us know. We'll be able to send you a recording. You see that link right there, the Integrated Health of Florida, florida.com. That click on that link, it'll take you straight to how to register directly for that webinar. And again, if you're not able to make it, I'll be sure to make sure that we get you a link to the recording so that you can hear how you can reverse type 2 diabetes. Share it with your family members, share it with those that are diabetic, because it may be this may be the information that can help save their life. Literally, I see it each and every day. So I appreciate that.
Yeah, for me, I'm with Whiteside Technical Solutions. So you have our website, Spivey, Eric. They always get in touch with me. Uh, I am who I am. The way I act on here is the way I act at the clinic, the way I act with my patients. I'm human. I'm not your typical doctor. They say, I have fun. People come into the doctor's office, they're already stressed. Man, we're here to have a good time. You're already stressed. Let's laugh. Let's just get to know each other. I'm not shy. They ask me questions. My patients know you ask me a question, I'm not gonna lie. They say I'm brutally honest, and I am, but it's not derogatory in any manner. If they say, well, how's your day been? Oh, my day sucks. This is why my day sucks. You ask me, I'm telling you. But that I just like being human. And that's the thing, is that a lot of doctors and providers don't show their human side or their human nature. Yeah, that's really it. So Whiteside Technical Solutions, you can find me that way.
All right. Anybody else have any questions? I want to thank you all both for coming out. For those that are still here, about 15 of y'all, thank you. That's a good number for us before our first live. And my babies that was just acting chaotic in the background. So if you want to get in contact, please, you have our contact information. You have Dr. Coy's contact information. Hit us up. Hit us up. We don't shy away from questions. We don't shy away from anything. Hit us up. We'll give you the answer. If there's different health fairs in the area, let us know. We'd love to join those as well. Like say Dr. Coy's in Florida. You're close to Miami. Is that where it is?
Yeah, Fort Lauderdale. Mm-hmm.
Okay. So you're close. I'm not. So you're Fort Lauderdale, wherever that is. I have no clue. I'll fly there. So if you're in the Florida area, holler at him.
South Florida. Let's say that.
Oh, so you are Miami. Okay. I definitely come in there. No, that's different. Sorry. But, sorry. But Dr. Whiteside, he's on the West Coast. Like G23 say, I guess the best coast. He's on the West Coast over there. Hit us up at whitesidetechsolution.com is our website. Info at whitesidetechnicalsolution.com. Hit us up there. Ask questions. Ask away. We have no problem. We have a lot of information to pass out to you all. We're not the gatekeepers. We're going to give you information. If there's something you don't want to ask your doctor, or you say, hey, should I ask my doctor that? If you question if you should ask your doctor, ask your doctor. Don't shy away. You're paying them. Ask that doctor. Like, you got two of the best doctors here, to be honest with you. You got two of the best doctors. They were straight up honest and open with you all. Vision asks one question. Derric Coy, what's your favorite pie?
I don't eat pie, so it's peach cobbler. Mary Hall know it. We used to have a peach tree in the backyard.
What about you, Coy?
Oh man, what's my favorite pie? Apple pie.
Apple pie.
Yeah.
Hey, look, I don't turn nothing down but my collar. So, G23 said, what part of the West Coast, Whiteside? Las Vegas, Nevada, right?
Yep, in Nevada, hanging out there.
Nevada. What I say? Nevada. No, yeah, whatever that is. Hold on, Derric, come here, little boy, because this boy been dying to talk to you. Devo. Come say hey to Da.
Hey, Da.
What's up, man? How are you?
Okay, go to bed. Bye.
So, and the other thing is that this is our first time doing Coy and I'll be happy to come back and do something else, some more talk. So I would say send us an email if you want to do another chat. We do not plan to do it every week. We just won't do it every week just because I respect people's times and people have stuff to do. So maybe once a month, maybe twice a month, depending on Dr. Coy's schedule. He's busier than me. Like I said, I'm military, so I'm kind of around a little bit more. I won't say I'm not as busy, but I work. I'll leave it like that.
Look, yeah, I'm about the busiest one here. I'm just holding on for dear life with these kids. So after we get off of this live, there's so much I got to clean up now, and I just cleaned up before the live, but that's a different story. Yeah. So, all right. So if there's no other questions, thank you all so much for joining us. Like I said before, if you want more of these, let us know. We have no problem putting these lives. I'm starting to slowly figure out how to do this moderator thing going through. So I'm still rough around the edges, but I'm getting there. I'm getting there with that part.
Did a great job.
So if there's no other questions, anybody else have any questions? Hey, Gina, if there's no other questions, we'll let you all go. Again, thank you so much. If you want to see us again or see them again, my little bootleg comedy per se, want any of that, let us know. Hit us up in the email or the chat. We'll bring it back again. Other than that, you all have a great one. We'll see you next time.
Peace, y'all.
Peace.